Welcome to Behavioral Interventions for People with Dementia, Dementia Basics, a frontline forces training presented by Superior Health Quality Alliance, or Superior Health. This is the first of 3 behavioral interventions modules for people with dementia who have behavioral expressions. The information contained in this module is relevant for nursing assistants who are on the front lines of providing care for patients, for anyone providing care to an older adult in any caregiving capacity, and even for those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding. The purpose of this series is to provide basic education about dementia and suggested interventions for dealing with behavioral expressions. In this first module, we will review definitions of dementia and behavioral expressions and how they manifest themselves in persons with dementia. It is not necessary to complete the entire series in one setting. You can leave and return to the course at any time. The objectives for this presentation are to review the definition of dementia versus Alzheimer's, to learn how behavioral expressions sometimes manifest themselves in people with dementia, and to identify basic interventions that can reduce behavioral expressions. According to the Mayo Clinic, dementia is a term used to describe a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with your daily life. It isn't a specific disease, but several diseases can cause dementia. Though dementia generally involves memory loss has different causes. Having memory loss alone doesn't mean you have dementia, although it's often one of the early signs of the condition. Alzheimer's disease is the most common cause of progressive dementia in older adults, but there are many other types of dementia. Dementia is a multifaceted condition. Residents with dementia, like Alzheimer's dementia, frequently have difficulty understanding spoken words and struggle to find the words that they want to say. Many residents can repeat words that they do not understand. This causes staff or family to believe that they understand instructions but refuse to comply with the requests. Residents with dementia can become frustrated as they struggle to find the right words. They also have a tendency to repeat the same questions. The brain changes associated with dementia trigger a decline in thinking skills, also known as cognitive abilities, which is severe enough to impair daily life and independent function. They also affect behavior, feelings, and relationships. Dementia is often incorrectly referred to as senility or senile dementia, which reflects the formerly widespread but incorrect belief that serious mental decline is a normal part of aging. Emotional symptoms include changes in personality, depression, agitation, and hallucinations or delusions. Dementia causes damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot normally communicate, thinking, behavior, and feelings can be affected. The brain has many distinct regions, each responsible for different functions. For example, memory, judgment, and movement. When cells in a particular area are damaged, that region cannot carry out its functions normally. At times, we may think that a person is acting a certain way on purpose, when in fact it is not true. People act in different ways based on changes in the brain. Behavioral disturbances known as behavioral expressions are the most challenging manifestations of dementia experienced in almost all people with dementia to different degrees. Common behavioral expressions are in 4 categories: mood disorders, for example, depression, apathy, and euphoria; sleep disorders, like insomnia, hypersomnia, or night-day reversal; psychotic symptoms, like delusions and hallucinations; and agitation, for example, pacing, wandering, sexual disinhibition, or aggression. As mentioned previously, the symptoms and disorders in behavioral expressions depend on the part of the brain that is affected. Behavioral expressions can be a sign of an unmet need that the resident is unaware of or unable to communicate. Treatment of behavioral expressions through a multifaceted approach that supports dignity and promotes comfort and quality of life is often the best first approach. In Module 2, you will learn of a real-time intervention you can use in the moment of the behavior that supports these principles. Personality changes for people with dementia can be challenging and sometimes frightening. In keeping yourself safe, it is important to remember the person isn't choosing this behavior. This is sometimes hard to remember, so don't forget to remind each other during the course of your work. Sometimes medications called psychotropic medications are prescribed when other interventions haven't worked over a period of time. They are not the first course of action because they have many negative side effects, such as an increased risk of falling. For this series, we are addressing non-pharmacologic intervention when caring for our residents. Other interventions that can be implemented in the moment are changing the environment by reducing noise, distracting residents to forget what they were asking for, or simply moving on to another thought. Modifying tasks by breaking them into simpler tasks can help residents retain focus. In summary, dementia is a general term used to describe memory loss. Dementia is not a normal part of aging. Alzheimer's is the most common form of dementia. Behavioral expressions refers to behaviors that people with dementia commonly display. Behaviors can be very challenging and can be a sign of unmet needs that a person has or is experiencing. Providing support, dignity, and promoting comfort are helpful interventions that can help in reducing behaviors. These are the references for people with dementia, Dementia Basics. Test your knowledge. Follow the link on the Frontline Forces webpage or in the YouTube description to the Behavioral Interventions for People with Dementia, Dementia Basics quiz.